Hi, lab staff. Thank you for tuning into this presentation. This is the first in a series of 3 trainings designed to educate school staff on the updated protocols for return to school during the pandemic. There are a number of policies and procedures that have changed since our summer programming has concluded. So this presentation was revised to include the most recent updates to the fall guidelines for return to school. This presentation in particular is on COVID-19 and what school staff need to know. So again, the goal of this training is to educate staff on COVID-19 and new protocols for mitigation in the school setting. Our objectives for today are to review the mode of transmission and symptoms of COVID-19, identify when to see the school nurse, when to call the doctor, and when to stay home, discuss revisions to lab policies and procedures for dismissal and requirements for returning to school. And through this training, you will be able to implement protocols for mitigation of illness in school. So as most of you already know, COVID-19 is a respiratory disease caused by a novel coronavirus that is spread from person to person via respiratory droplets. These droplets are transmitted between people in close contact with one another through speaking, coughing, sneezing, and direct contact with saliva. Respiratory droplets enter the body through inhalation or through exposure to mucous membranes, which are the eyes, nose, and mouth. So how do you get COVID-19? A person can contract COVID-19 if they come into contact with another person infected with the virus, if someone infected coughs or sneezes directly onto them, or if they touch any surface with droplets from an infected person's cough or sneeze and then proceed to touch their eyes, nose, or mouth. Signs and symptoms of COVID-19 can be pretty variable and range from mild to severe illness. In about 80% of cases, we expect to see any of one of 3 main symptoms, which are a fever of 100 degrees or above, a cough, or shortness of breath. However, in many cases of COVID-19, there are additional symptoms that might include muscle or body aches, a new loss of sense of smell or taste, fatigue, headache, sore throat, congestion or runny nose, new rash, especially on the fingers and toes, nausea or vomiting, and diarrhea. These secondary symptoms we do expect to see in conjunction with the top 3 symptoms. Because coronavirus does have a pretty variable incubation period, symptoms may appear anywhere between 2 to 14 days after exposure to the virus. Many of our staff and students do have asthma or seasonal allergies or some other underlying condition that may present with respiratory symptoms, such as cough, congestion, or shortness of breath. So it's important to keep in mind that these symptoms are not necessarily an indicator of COVID-19. Nursing will consider each unique situation carefully to determine if further actions are needed. All lab staff and students will be required to complete an online daily symptom checker prior to attending school each morning. For those of you that worked the LSAP, LSTP programs, you got sort of an introductory session to what this is going to look like. For LSAP, we did use a Google Forms document to report on the daily symptom checker, but we are currently finalizing an application that will be available on your phone or on computer to be able to answer these questions. The daily symptom checker is a self-assessment or parent-guardian assessment for students of symptoms and is essentially an affirmation of healthy status. So it is 3 multiple choice questions, the first of which is asking you to check your temperature at home and certify that you have a temperature of less than 100 degrees Fahrenheit in order to attend school. The second question is asking, do you have any symptoms from the list that are indicative of COVID-19 that are unrelated to an underlying medical condition? The third question is, have you been exposed to a confirmed case of COVID-19? In any of these situations, staff and students cannot come to school if you do have a fever of 100 or above, if you are exhibiting symptoms of COVID-19 that's unrelated to an underlying diagnosis, or if you have been exposed to someone who has been diagnosed with COVID-19. Lab nurses will not be performing temperature checks or screenings upon arrival to school. The daily symptom checker is the requirement for attendance, and the reason for this is twofold. First, checking temperature upon arrival is unreliable. If we're using our infrared no-touch thermometers outside, if a staff or student is presenting before they enter the school building to have their temperature taken, and we're using that thermometer in direct sunlight, if it's particularly hot outside, or if you've been sitting in your car or your student has been sitting in a lab van for an extended period of time and it's hot and you're sweating, the infrared thermometer is not going to read an accurate result. It might in fact read a false positive and indicate a fever in a situation where there may not be one. Second, anyone who's feeling sick, anyone who's feeling feverish, anyone who may have been exposed to somebody who has active COVID-19 shouldn't be presenting to school in the first place. We are being hyper vigilant and trying to reduce the risk of exposure to our lab community. So anyone who is meeting this criteria shouldn't come to school in the first place. Students that are experiencing these symptoms or may have a fever or may have been exposed, if they're getting on a van, they are potentially exposing their peers and other staff members. Or if a staff or student is presenting to cab duty and in close proximity to colleagues or other students, they are potentially exposing them in that scenario as well. So really, ultimately, what we are pushing for is that everyone is self-screening at home before they even get on the van, get in their cars, present to school, so that we can reduce the risk of exposure to our entire lab community. So when should you see your school nurse? You should visit the school nurse if you or any of your students exhibit signs of fever, shortness of breath, or 2 or more of the symptoms that are listed on the previous slides that are suggestive of COVID-19. You should also call the nurse immediately if you or any of your students are experiencing any emergency warning signs. These signs are those that are indicative of hypoxia. So if you or your student's lips or face are suddenly turning bluish or ashen, if there's persistent pressure on the chest, confusion or inability to wake, or difficulty or trouble when breathing. These signs are potentially indicative of an impending medical emergency. So if you see any one of these emergency warning signs, you do want to report that to the school nurse immediately. What to do if you are sick? So if you or any of your students need to see a school nurse for possible illness during the school day, please follow the steps indicated below. So first and foremost, you're going to want to call the nurse and inform them of the situation, give them an overview of the symptoms that are present at the time, and this will enable us the ability to consult with you and offer advice on how to proceed going forward. Next, as directed, you're going to go to the designated medical waiting area for assessment. This is separate from the health office or treatment area at your individual program site. Staff in the classroom should close off the area used by the sick student or staff member. The area is isolated to the specific location that that person was inhabiting prior to experiencing those symptoms. So you don't need to close off your entire classroom environment, just that immediate area that that person was present in prior to feeling feverish or those symptoms that are indicative of COVID-19. And then finally, the nurse will determine if dismissal from school is required in that situation, obviously dependent on the symptom presentation, and of course, if there are any underlying diagnosis that may be contributing to that person's current state of being. As I mentioned, health offices and treatment areas will be reserved for healthy students who need medications, treatments, or injury care. Do not enter these areas if you're feeling sick. To the best of our ability, we want to decrease the risk of exposure for all of our staff and students. So any staff or students that may need to see a nurse for reasons other than potential illness should be able to access areas that don't have that risk of cross-contamination. So our health offices, our treatment areas should be reserved for those individuals. So we have a number of updated guidelines for school, including dismissal and return to school. Students and staff members will be excluded from school under the following parameters as indicated by our lab COVID-19 protocol addendum. Any students or staff members with a fever of 100 degrees or above, or any students or staff members who have symptoms that are suggestive of COVID-19, or any students or staff members who have had a known exposure to a confirmed case of COVID-19 cannot attend school. Students and staff who are dismissed from school for these reasons should contact their healthcare provider for further guidance. So who should get tested? According to the MDPH, individuals who meet any of these criteria are required to be tested for COVID-19. So symptomatic individuals, even those with mild symptoms, are required to be tested for active COVID-19 prior to return to school. Additionally, close contacts of confirmed or clinically diagnosed COVID-19 cases are also required to be tested for active COVID-19 prior to return. And just a note on the difference between confirmed or clinically diagnosed cases. A confirmed case is someone who has presented for active testing and received a positive test result. Someone who's been clinically diagnosed has in fact seen a doctor, and based on their symptom presentation, their primary care physician may consider them a presumptive positive case, which is a clinical diagnosis of COVID-19, even if you haven't officially been tested. Another note is COVID-19 tests in the case of exposure should be performed 4 to 5 days following the exposure to reduce the risk of a false negative result. Because the incubation period is so variable, that 2 to 14 day window, we do want to delay the COVID-19 testing for as long as feasible to ensure that the results are accurate. So in that 4 to 5 day window, those days leading up to that, you are going to want to quarantine at home, take the test, and let us know if you have a positive or negative result. Here below, I have the link to testing sites for COVID-19 in the state of Massachusetts. I will include a printout at each program site so that you guys will have access to that. In the event that you or any of your students do need to get tested, you will see all of the testing sites that are available to you and your students within your district or close to the city or town that you live in. So COVID-19 reporting requirements. All lab students and staff members are required to report positive COVID-19 test results to enable contact tracing and public health reporting. So if you have a positive test, if one of your students has a positive test, who are they reporting those results to? It should be the health office nurse at your respective overseeing location, whether that's Arlington High School or Lexington High School. You can report those results to myself, Janelle Borowski, or Amanda McAdam. And who will the results be shared with? So we're required to report positive case results to public health officials, our Board of Health, the Massachusetts Department of Public Health, and also to inform students and staff members in the cases of exposure. This is part of the contact tracing efforts to ensure that everyone that needs to get tested is able to get tested. However, no personal information is going to be shared. We're not going to disclose the identity of a positive case to anyone. So in the event that a student or staff member has a positive COVID-19 test result, we are not going to share that information with anyone within our lab community or with our public health officials. Though that identifying information is confidential and will be kept private, we're simply reporting that there is in fact a positive case at our school location. So just a reminder that close contact in the context of the guidelines refers to proximity within 6 feet for at least 15 minutes while the COVID-19 case was symptomatic or within 48 hours of onset of COVID-19, or direct physical contact with infectious secretions, so being sneezed on, coughed on, contact with saliva, while not wearing the recommended personal protective equipment. So our updated policy for exclusion for return to school for health reasons related to fevers is that students and staff members who are excluded from school for a fever may only return when the temperature is below 100 degrees for a full 72 hours without the use of fever-reducing medications. This is an increase from our previous policy, so please make sure that you and your students and your classrooms and departments are aware of this change. You can refer to this in the Lab Policy and Procedure Guide on page 11. Updated return to school guidelines for anyone who is exhibiting symptoms of COVID-19. So students and staff members who are excluded from school for symptoms that are suggestive of COVID-19 may return under the following parameters or as directed by local boards of health. And just a note that boards of health do supersede our guidelines. So in the event that your local board of health, the board of health in the city or town in which you reside, has more restrictive return to school guidelines, you do have to follow their directives, as again, they supersede our protocols. The lab protocol for criteria for return to school in the event that an individual is experiencing symptoms of COVID-19 is that an active COVID-19 test must be performed with a negative result, and the individual must be fever-free and symptom-free for 24 hours without the use of medication. Alternatively, in the event that an individual is not tested, in this case, there's either no access to testing at the time, there's a shortage of COVID-19 tests, or if the individual chooses not to be tested for their own personal beliefs, then they must remain home in self-isolation for 14 days from symptom onset. They must be fever-free for 72 hours without the use of fever-reducing medications, and they must be symptom-free for 24 hours, also without the use of symptom-suppressing medications. If the active COVID-19 test is performed and there is a positive result, please follow the guidance for positive COVID-19 testing, which is in one of the upcoming slides. So students and staff members who are excluded from school related to exposure to an active COVID-19 case may return under the following parameters, or again, as directed by local boards of health. An active COVID-19 test must be performed with a negative result, and the individual must remain home in self-quarantine for 14 days from the date of exposure. This is a change from our summer guidance, which initially we were accepting negative test results before return to school, but the updated guidances have enforced that we require staff to quarantine regardless of the COVID-19 test result, simply because that incubation period is so variable and there is that risk of a false negative in the event that you may or may not have COVID-19. So anyone who has been exposed does have to quarantine for 14 days from that date of exposure. Again, if a person is not tested for whatever reason, they have to remain home in self-quarantine for 14 days from that date of exposure and be fever-free for 72 hours without the use of fever-reducing medications, and be symptom-free for 24 hours without the use of symptom-suppressing medications. If there is a positive COVID-19 test result, you are going to follow that guidance for positive COVID-19 tests, which is in the slide to follow. So the return to school guidelines for students and staff who have tested positive for COVID-19 are dependent on whether the individual is symptomatic or not experiencing symptoms at all. So for those with symptomatic diagnosed COVID-19, the criteria for return to school is a minimum of 10 days in isolation from the first day of symptom presentation. Also, fever-free for 72 hours without the use of fever-reducing medications. That is a change from our previous policy. Respiratory symptoms have to have significantly improved. The individual will need a doctor's note with clearance for return, as well as clearance from the Board of Health in the city or town that they live in. Again, local boards of health may have more or less restrictive guidelines. So if they are more restrictive than our lab guidelines, you do have to follow what your local board of health is requiring prior to your return. For those who received a positive COVID-19 test result but never experienced any symptoms, the criteria for return to school is no symptoms for 10 days following the positive COVID-19 test. The individual must be fever-free for 72 hours without the use of fever-reducing medications. The individual also needs a doctor's note with clearance for return to school, as well as clearance from the Board of Health in the city or town that they live in. So just some general guidance for if someone in your home is sick. Continue to practice everyday preventative actions as usual that you would if you were in school or if you were at home. Keep the ill person in a separate room for others in the household to reduce that risk of exposure. If caring for a sick individual in your household, monitor your own health as well. Please be sure to wear the appropriate personal protective equipment if you do have access. Keep surfaces disinfected and also avoid sharing personal items. This is to reduce the risk of cross-contamination between individuals. If you become sick, stay in contact with others by phone or email. Certainly feel free to reach out to either of the lab health offices or myself. We would be happy to support you and provide resources in any capacity that you may need while you are sick at home. And number 6 is for anyone that is healthy or sick, or whether or not someone in your household is sick or not, this is for everyone across the board. You want to take care of the emotional health of your household members, including yourself. This is certainly a challenging time for a lot of people. There's a lot of stress and anxiety associated with this pandemic and everything that comes with it. So you want to ensure that you are practicing self-care, that you're taking that time for yourself to be able to engage in healthy habits, whether it's healthy eating, exercise, getting out of your house and taking a walk, taking some time for yourself and engaging in those activities that center you and ground you and make you feel at peace, because ultimately, at the end of the day, self-care is the only thing that is going to help you move forward through your anxiety and your stress. When we are stressed, our body releases a corticosteroid called cortisol, which reduces our body's, essentially our immune capability to fight off infection. So if nothing else, please engage in self-care to ensure that you're able to keep yourself and everyone around you safe. General protection tips are: maintain physical distancing. We are encouraged to maintain a physical distance of 6 feet or more whenever possible. Physical distancing is the terminology that we're using instead of social distancing, because we don't want to enforce the idea that we should be socially isolating during these times. Social connection is one of the major ways that we're able to process and work through all of this crisis, honestly, general crisis that's happening around us. So physical distancing, not social distancing. Keep objects and surfaces clean and disinfected. Wash your hands frequently, and don't touch your eyes, nose, or mouth. It's honestly rather surprising how often we go to touch our face during the day when we're not actively thinking about not doing that. To the best of your ability, try not to touch your face. If you absolutely must do so, please make sure you wash your hands before you do. Again, physical distancing, 6 feet is the ideal safe distance. You want to keep at least that distance between yourself and other people whenever possible. And then, of course, increasing that distance with our vulnerable populations. So elderly persons or immunocompromised individuals, as they are the most susceptible to the virus. So, okay, I know this is a lot of information to process, but following these protocols, all of these new policies and procedures that are outlined by the DPH, by the CDC, by DESE, are going to enable us to operate in the school setting in a safe environment. We all have to do our part to ensure that our entire lab community is operating to the high standards that we have for safety, education, care at our lab program. So the next steps are the competency assessment, which is a short COVID-19 post-test. And then you guys are going to want to review the updated lab protocols that are included in the COVID-19 Health and Safety Protocol Addendum, which I included as an attachment to the email for this training. As always, if you guys have any questions or concerns about any of the content in this training or in the protocol addendum, please feel free to call me, email me. I'm happy to answer your questions and help you navigate any student-specific concerns, your classroom-specific concerns, or any other questions that you might have. So thank you guys for joining me in this presentation, and I will see you for the next segment in our health and safety training series. Thanks, guys.